For this case study, imagine that you are shadowing a primary care physician. Today, the patient you are meeting with is named Maggie. Maggie is 20 years old. She is 5'6" and weighs 110 pounds. Her BMI is 17.8. Together with the physician, you ask about her medications, lifestyle, and activities. She's on Accutane to combat acne, but takes no other medicines or supplements. She's a full-time student in her junior year of college. She plays club field hockey and club lacrosse for her school and says that she works out at the gym when she doesn't have practice or a game. In terms of her eating patterns, she has been a strict vegan for 2 years, and when sharing her typical day of eating, says that she doesn't eat breakfast, has a baked sweet potato every day for lunch, and eats mostly fruits and veggies. The doctor mentions that it seems like a very light intake for such an active, growing young adult, and Maggie responds that eating cleanly is very important to her. The doctor asks Maggie what symptoms she has been experiencing, and she mentions constipation, trouble sleeping, and frequent joint pain. She also shares that she hasn't had a period in months, though she's not sexually active and could not be pregnant. The doctor writes down that she's quite pale, and you notice that her lips are cracked. As Maggie prepares to leave the exam room, she becomes dizzy and has to sit back down. You offer her juice to address potential low blood sugar or dehydration, but she refuses. The doctor decides to admit her for further testing and treatment, wanting to assess her blood sugar levels and vitamin levels. He also wants to test for anemia, run a DEXA scan to determine her bone density, and bring in a psychologist to work with her. Questions. What conditions or factors could be causing Maggie to present with these symptoms, given her eating patterns and lifestyle? Which vitamins might she be deficient in? How do you know? How could this be addressed, through dietary choices, supplements, or otherwise? What vitamins is she most at risk for having excess levels of? How could her diet, environmental factors, medications, or other factors be contributing? What other conditions or health outcomes is Maggie at risk of developing? As a nutrition educator, what would you recommend in terms of treatment to address her current condition and prevent these risks? Thank you for following along. References have been shared with Professor Williams. I look forward to hearing your responses to these questions.